Hi, my name is Christian French, and I'm going to be going over muscle hypertrophy in this presentation. So what is muscle hypertrophy? Essentially, it's just enlargement of skeletal muscle fibers in the cross-sectional area of a muscle. So it's basically the enlargement of the actual actin and myosin components of the muscle, so increasing contractile components. So basically what a lot of people refer to as muscle size. So there's two types of hypertrophy from what I found from my research. There's sarcoplasmic hypertrophy and then myofibrillar hypertrophy. They're both hypertrophy, but sarcoplasmic hypertrophy is when there is an increase in the non-contractile tissues and the non-contractile components of the muscle, and it's a lot more fluid than it is actual contractile components, meaning that you likely won't see as much strength increase, although you will have that enhanced hypertrophy. So you'll see this more so in bodybuilders. They're very big, very muscular, but they may not be as strong as they looked. Whereas myofibrillar hypertrophy is an increase in the contractile components, so the actin and myosin, like I stated earlier, meaning that you will probably see improvements in strength along with the size. So that's thinking more like a power lifter. Obviously, like, they may not be as big as a bodybuilder. They're still pretty muscular for the most part, but they are very strong. And I think this picture describes it pretty well. Got the myofibrillar hypertrophy, more of the actual contractile components versus the sarcoplasmic hypertrophy. So some of the key variables for hypertrophy training, main ones are going to be sets and reps, rest times, and intensity. So the most common prescription for hypertrophy is usually 3 to 4 sets of 8 to 12 reps, and that holds pretty true. Found some research by Brad Schoenfeld. He basically said 6 to 12 reps is kind of the range where you see the most progress, but I have seen some research that says anywhere from 5 to 30 reps can be good for hypertrophy depending on how close you are to failure. And just progressing that load over time. 8 to 12 reps per the textbook, with higher repetition sets used for hypertrophy. 6 to 12 seems to be the best for eliciting that adaptation. And then as far as rest between sets goes, usually 60 to 90 per second is probably between sets is probably best. Although some shorter rest periods of 30 seconds or even less do stimulate metabolic stress, which is key for muscle hypertrophy. It usually isn't enough time to regain strength between sets. So you may have really good results on that set, but if you only wait 30 seconds, you're not going to get very many reps. You might even fail to get into that 6 to 12, 8 to 12 rep range, and then your subsequent performance on later sets is going to be not as good. So usually a minute to a minute and a half between sets is good, but also good to think about smaller muscle groups are usually going to take a little bit less time to recover between sets, and then larger muscle groups are going to take a little bit more time. So I might be able to take 20 to 30 seconds between sets of calf raises because my calves are a much smaller muscle group than, say, my quads or my hamstrings. I'm probably going to have to take closer to 90 seconds between a set of squats because my quads are just a lot bigger than my calves. And then the intensity is going to be dependent on the target number of reps, obviously, but generally you want to be at least 65% of 1 RM to elicit hypertrophy, and that will kind of usually get you in that 6 to 12, 8 to 12 rep range. As far as exercises go, many of the same exercises that you use for strength can also be used for hypertrophy by just kind of manipulating the sets, reps, intensities, and rest times. I think an important thing to consider when selecting exercises for hypertrophy is the actions of the muscle you're trying to target, and just thinking of different muscle groups that have multiple muscles that are going to have different attachment points will probably require multiple movement patterns and or angles to fully stimulate symmetrical development of that muscle. So I have a couple examples here. The pectoralis, having an incline bench press is going to get more of the clavicular head. A flat dumbbell bench press is going to get more of the sternal head. And then obviously the secondary function of the pec is adduction. So having like a cable fly where you're bringing the arm away from the body and then closer to the body is going to get full development of the pecs. And then hamstrings, obviously it's going to be hip extension and then knee flexion. So having one exercise for hip extension, like a Romanian deadlift, where you're working more of the proximal part of the hamstring, more of the semimembranosus and the semitendinosus, as opposed to like a seated leg curl. It's going to be more distal down towards the knee and going to be working more of the biceps femoris. And here are my references. Thank you for watching.